Hi, thanks for watching Jason Adam TV. If you haven't, please click subscribe, give me a thumbs up, and leave a comment in the comment section below. Okay, today's topic is about an incident that took place last weekend in Franklin, Tennessee. Tennessee is my home state. That's where I grew up. I'm very familiar with Franklin. Actually, I lived there as a child many years ago. So this article appeared in NBC News, and the title is "We Will Find You. Tennessee Parents Protest School Mask Mandate. People in Masks Heckled." So according to the article, angry protests erupted in Franklin, Tennessee after a school district reinstated a mask mandate for elementary school students, with some people yelling at and heckling those wearing masks in the parking lot at a meeting about the measure. The Williamson County Board of Education approved the mandate Tuesday night in a special session. It will begin Thursday and run at least until September 12th, according to the district. People opposed to the mandate gathered outside the meeting chanting, "We will not comply." In one video, a man screamed at a person wearing a mask on the way to their car, saying, "We know who you are." The same man said later, "You'll never be allowed in public again." Another man said, "You can leave freely, but we will find you." So this is how parents are reacting to the school district in Franklin, Tennessee, requiring children to wear masks to school. So there's no question as to whether masks are effective at preventing the spread of COVID-19. And with the recent statistics in the U.S. showing that children are more likely to be hospitalized and suffer more with the latest Delta variant that's spreading across the nation, this is a serious concern. And people should take all steps necessary to at least prevent the spread of COVID-19. So, how do we know masks are effective? Well, there have been studies. In one study, there were 2 hairstylists in Missouri who tested positive for COVID-19. They wore either a cotton mask or surgical mask while they were working as hairstylists. And although they passed COVID-19 to members of their households, their clients did not get COVID-19. In another preprint study posted in early August and not yet peer-reviewed, they found that weekly increases in per capita mortality were 4 times lower in places where masks were the norm or recommended by the government. The researchers looked at 200 countries, including Mongolia, which adopted mask use in January, and as of May had recorded no deaths related to COVID-19. Another study looked at the effects of U.S. state government mandates for mask use in April and May. Researchers estimated that those reduced the growth of COVID-19 cases by up to 2 percentage points per day. They cautiously suggest that mandates might have averted as many as 450,000 COVID cases after controlling for other mitigation measures, such as physical distancing. According to, I'm taking this from an article in Nature magazine from October 6, 2020. There's even more research that points to the efficacy of masks, more recent research. So in this article, according to Jeremy Howard, a research scientist at the University of San Francisco in California, quote, "You don't have to do much math to say this is obviously a good idea in regards to wearing face masks. And there's a reason why surgeons have worn face masks for a long time, long before COVID-19, and that is they know, research has proven that viruses and other contagions spread on droplets that are invisible, droplets of spit that come out of your mouth when you breathe and speak. And the masks help prevent these droplets from getting on patients. So we know that the masks are effective at stopping droplets. One of the arguments I've heard from anti-maskers is that that medical masks, like the surgeon's masks, they don't filter viruses. Viruses are too small. While that's true, viruses usually cannot survive very long or travel very far outside the body without being contained in some other medium, such as your saliva. And the masks are effective at stopping your saliva from reaching other people. So in Taiwan, it was never a question. The government immediately, when cases started spreading in Taiwan due to reduced quarantine for pilots in Taiwan, when the cases started spreading, the government immediately mandated masks in public places. They even mandated them when traveling in the car with other people, which many Americans would think is silly, but it makes sense. I mean, if you're traveling in the car, you're carpooling with someone you don't usually travel with, you could spread the virus that way if you're not wearing a mask. So as a result, we had an outbreak in middle of May 2021 in Taiwan, and it's under control now as of August 15th, so the middle of August. So for a few months we had a soft lockdown, and masks were mandated, and fines were given out for people who did not mask in public. And it's been effective. We've gotten the virus under control. Initially, in the beginning, the cases got up to over 500 per day, and now they are down in the single digits. I think we had around 4 today, 4 local cases of COVID. So masks are effective in stopping the spread of COVID. Masks do not harm your health. They do not reduce the amount of oxygen in your bloodstream. There are videos, if you go to YouTube, there are videos of doctors who have connected themselves to the blood oxygen monitor with their masks on and showed that the mask did not have any effect on their blood oxygen level. So it's, the research has shown time and time again that masks help stop the spread of COVID. They're not convenient, and they're a hassle, but they're a necessary hassle to stop the spread of COVID. So you don't need an N95 mask. Just a medical mask or cloth mask alone will provide some protection. Another issue that people are talking about is the vaccine. A lot of people don't want to take the COVID-19 vaccine. They think that the vaccine is more dangerous than getting COVID, which is absurd. According to Taiwan CDC, COVID-19 vaccination is the most effective way to prevent infection and reduce severe illnesses and deaths from COVID-19. So far in Taiwan, as of June 16th, a total of 1,133,515 people were vaccinated with the AstraZeneca COVID vaccine in Taiwan. And out of this over 1,133,515 people, there were 11 cases of death following vaccination out of around 1.1 million. Of these 11 people, 8 were aged 75 or older, and most of the cases of death were elderly people with chronic diseases. The Taiwan CDC also emphasized that they have not been able to link any of the causes of death, the 11 deaths from the vaccines, to the vaccine. So out of over 1 million people, 11 people died, and the government has not been able to connect those deaths to the vaccine. Most of the people had pre-existing conditions, and most of them were elderly. So the vaccine is very safe, extremely safe, much safer than COVID-19. If you look at the chance of death from COVID-19 compared to the vaccine, there's a huge difference. You're much more likely to die of COVID-19. And for the newer variants, we have less data. The COVID-19 variants like Delta, we have less data than the original forms of COVID. And so, for instance, we are not as certain yet how these new variants will affect younger people. The preliminary evidence seems to show that the Delta variant is much more dangerous for children and young people than the other variants. So I took the vaccine. I experienced tiredness for 1 day, and that was the only side effect I had. I've heard other people on social media say that they had a fever for a day or had chills for a day, but then they were fine. And when you assess that compared to getting COVID-19, of course, it would be much more desirable to have some slight side effect from the vaccine than to experience going through COVID-19, especially when we don't know how the newer variants will affect people. So the vaccines are free. They're free in Taiwan, they're free in the US. As far as I know, they're free in most countries. Masks are now plentiful. They weren't at the beginning of the outbreak, but they are now. And they are relatively inexpensive. The medical masks. Here in Taiwan, I can buy a box of 50 for 200 NT, which works out to about, 200 NT in US dollars. So it works out about $7 US dollars for 50 medical masks. So the masks are not that expensive. They're plentiful now, and there's no excuse not to wear one. So when I see this news, like people in Franklin threatening other people for wearing masks, I think, what the heck is wrong with people? What happened? In Taiwan, people don't question about the efficacy of wearing masks or getting vaccines. It is not political here. We don't have politicians saying, well, I don't want to take away people's freedom. It is just, we are in, I know I've kind of been on the fence about this before, but we are in a pandemic that has killed millions of people worldwide. And in times of emergency, you can be required to do certain things, I know, to help others. I know I've mentioned, during World War II, families had to ration things in order to support the war effort. I just, honestly, if you know what's going on in America right now, please leave a message and let me know. I'm perplexed. I don't know how people can ignore research from epidemiologists who have been in the field working for decades. Thank you for watching Jason Adam TV. If you have any questions or comments, leave them in the comment section below. If you haven't, please subscribe and give me a thumbs up. Bye-bye.